Let me now welcome Dr. Patty Manning. Dr. Manning is the Chief of Staff and a developmental pediatrician at Cincinnati Children's Hospital. Dr. Manning, thank you very, very much for being with us. I wonder if you could tell us, maybe start off with what is the research telling us about kids being able to spread the virus?
Sure. Thank you, Governor. It's a privilege to be able to speak on behalf of such an important topic and on behalf of the Ohio Children's Hospital Association. You know, we're really just learning what children do in terms of spread, but I think it's important to restate what you've already said and what Dr. Barnard said, and that is that children do get COVID. They are not immune from COVID, and when you have COVID, you can spread COVID. There's some very early research that suggests that the type of spread may differ by the age of child, but it's preliminary and it's hard to really extend that research beyond just some initial thoughts about who might be more contagious. I think it's safe to say that if a child has COVID, they can be contagious, whether they're symptomatic or not. And as we have more time, we'll learn more about what types of children spread, who spreads more. It's fair to say that younger children who need closer contact in their care might be at more risk of spread. And so that the younger you are, the more likely you may be to spread because your care has to be in more close contact.
But that comes about because of the length of time with that child and maybe also because of the closeness with that child. And those are two factors that are important.
That's very important. It's a very good point that, you know, we talk a lot about close contact and what close contact means with regards to transmission. And so close contact, to remind everyone, is under 6 feet for more than 10 or 15 minutes. And so as you're obviously aware, most young children need close care. You have to hold them or you have to feed them, and you're going to do that for longer than 10 or 15 minutes. But if you can be distant from older children, more than 3, 4, 5, 6 feet, and you can do that for, or when you are close, it's under 10 minutes, you're at less risk.
And then, Doctor, you may have covered this, but what about kids over 10, the older, the teenagers, maybe early teens? What? So
the older children and the teens, as we heard a little bit already, especially the teens and the mobile teens, are at great risk for spread because they're very active and they're in close contact with each other. We don't have a lot of evidence that says that they spread more or they spread differently, but again, that's another area of important study that we're waiting on.
I wonder if you can talk, you know, the reason we're doing this today, Doctor, is as people are getting ready to send their kids back to school. And I wonder if you have, based on your research and your knowledge, any kind of tips for students or parents, administrators, to keep schools safe. And I know schools have been working very hard, but we thought we would take this opportunity to have you talk directly to people of Ohio and tell them what you know based on your studies and your expertise.
Absolutely, and I just want to echo what you said about the hard work that's being done by all the school leaders and administrators. They have such a huge lift, and the exposure that I've had to the work that they've done has been, it's been just impressive what school leaders are doing to keep our kids safe. And we recognize that opening a school is a local decision. It's a community decision. It's based on many local factors. As pediatricians, we do support and are biased in the direction of in-person education when possible. And for that education to be safe, there are really 4 very specific strategies in order of importance that we want schools and families to be aware of. The first is masking, that everyone can wear a mask, everyone should wear a mask. It's recommended that children in K through 12 wear masks. That will protect everyone, teachers and students. The second is distancing. And so we talk a lot about the importance of distancing in 6 feet. And 6 feet is optimal, 6 feet is great, but 3 feet is also good. And 4 feet's a little bit better than 3 feet, and 5 feet is better than 4 feet. And so we know there's a continuum of safety that can be in place in schools. We also all recognize how hard it may be to keep children 6 feet apart at all times. So I've talked to many families and many teachers about doing your best, recognizing that some distance is better than no distance, and 6 feet is optimal, but it's not always going to be achievable. The third aspect of safe care and safe education is hand hygiene. And so this is something we've all been hearing a lot about, washing our hands, using hand sanitizer. This is something that should happen on a regular schedule in schools. It should be made fun, and kids can be engaged in this type of activity and be part of that. And then the fourth most important factor is cleaning surfaces. And sometimes we place a lot of emphasis on cleaning surfaces as if it's the most important factor, and it is important. But the good news is that COVID is not very hardy. It dies when it dries, and it dies in the sunlight. And so we don't need extensive, over-the-top, elaborate cleaning processes. We need our usual routine cleaning processes. We need to wipe down high-touch surfaces, and we need to really focus on hand hygiene, because if our hands are clean, then we're all really protected. Another important factor is ventilation. And there have been a number of studies that demonstrate that areas that are better ventilated have lower risk of disease transmission. We know that schools vary in their ability to provide different degrees of ventilation, but at any time that a teacher can open a window, can take a class outside when it's appropriate, at the discretion of the teacher, those are activities that will help as well.
And those, I think you said at the beginning, those are cumulative. Do all of them? Is that the
cumulative? They're cumulative, but they're in order of importance. So the masking is the most important, followed by distancing, followed by hand hygiene, followed by surface cleaning. But together, they create a very robust package for safety. And I want to also echo what you said earlier, and that is that you know, what we do in our community will impact our schools. We are all connected. We are all in this together. And so what happens in our communities will impact our schools, and what happens in our schools will be reflected in our community. If we want children to do these things, if we want children to wear masks, we have to wear masks. We have to model that behavior for them as the adults and the parents in their lives. And so it's really all for one in this type of climate that we're in.
Doctor, I wonder if you could, you know, talk a little bit about kind of the stress. I mean, this has been a stressful time for adults, stressful time for kids. Kids are going to be starting back in school. Some of the protocols that they're going to have to follow will be different. Some kids will be wearing masks, maybe for the first time. Any advice for parents? Any advice for teachers as we kind of start back in this great unknown, or something at least different for us?
Exactly. One piece of advice I've given a lot of families, including just this morning when I was in clinic, is to let children know that it's okay to be uncertain. There's a lot of uncertainty. We've been dealing with a tremendous amount of uncertainty. And sometimes children look to us for recognition and approval of that uncertainty. Yes, we know it's different. We know that things have changed, and that's okay. But we're going to learn together as we go. So parents talking to their children and giving them some warning and some heads up about what may be coming, doing a little bit of rehearsal around mask wearing, about hand hygiene. We talk a lot in my field about using stories and social stories to kind of illustrate, here's what's going to happen, here's what it might look like. Most children and most people really benefit from structure. So preparing children who may have not had a lot of structure over the past several months, preparing them for the restart of some structure, of sleep schedules, wake schedules. I talked about that literally all morning with families, about the importance of getting back onto a schedule and how much schedules and predictability help everybody. And so I think there are a lot of basic things that families and teachers can do, starting with just talking to children and trusting that they're actually going to understand and be able to comply.
Dr. Manning, thank you very much. Very, very helpful. I wonder if you could stay with us a little bit. We may have some questions from the news media, but thank you for those good instructions and those good tips. We appreciate it very, very much.